Hi all, this is Steph Giordano with Human Services Research Institute, or HSRI. In this training module, we're going to take a look at about the first half of the background information section of the 2017-18 Adult In-Person Survey. So I'm going to go a bit more in depth than I would with the refresher trainings, and really kind of talk about the intent of some of the questions, as well as provide additional explanations and definitions where applicable. All right, so jumping into the background information section here, just another reminder, as I mentioned in the previous module, always take a look at the top of your paper, or if you're entering information into the Odessa online data entry system, please make sure that you're looking at the correct up-to-date adult in-person survey, so it's for 2017-18. So these data that are collected here in the background information section are information that are used for reporting purposes. I also want to note that we'll see a number of questions throughout the section, like question BI2, date of birth, that are highlighted in yellow. That means that this information is used for risk adjustment in our analysis, essentially meaning that when we do analyses, that when we see differences from a state compared to the national average, that any differences we see are not due to differences in the kind of characteristic makeup of the survey or of the sample, but by something that's happening in the state. So that is to say that these questions highlighted in yellow are especially important to have collected from the most up-to-date and current records possible for the individual. So we start out the background information section with questions around the person's kind of personal demographics. So we have the zip code here. This is entered as a numeric value, but when it goes into our online data entry system, it will be transformed into a urban or rural designation. We ask about date of birth. Starting, I believe, last year, we now only collect the month and year, so you don't have to enter the day the person was born as well anymore. We ask about the person's gender. We do offer that other category for people who do not identify as male or female. And what is the person's race and ethnicity? This is a check all that applies, so you can check any racial designation that the person would consider him or herself to be. We have a couple of questions around guardianship, so whether the person does have a legal appointed guardian or conservator, and if so, whether it's a limited or full guardianship or conservatorship. You may also know that the person does have a legal guardian or conservator, but there is no record of whether that is limited or full, and that's when we would use that for response, yes, unable to distinguish between limited or full guardianship. Question 6 then asks if the person does have a guardian or conservator, what is the relationship to the individual? And this is a check 1. We ask about the person's marital status, and then we have a couple of questions around parenthood. So question BI8 asks whether the person is a parent, and if so, whether they have a child who is under 18 and or over 18. For individuals with a child under 18, we want to know whether their child lives in their house. And starting with BI10, we have a few questions around diagnoses. So whether the person is diagnosed with an intellectual disability. If so, what is the level of ID? Question BI12, what other conditions are noted in the person's record? So this is really, really important here to make sure that these are medically or professionally diagnosed conditions that are in the person's record. For each of the response options here, we do have a no, yes, and don't know response, and really it is crucial for data collection and analysis purposes that we have a no, yes, or don't know marked off for each of these response options. Question BI13 is very similar. What health conditions are noted in the person's record? So these tend to just be longer term kind of conditions. Again, we have those no, yes, and don't know categories for each response option that we do need completed for each response here. We have some questions around communication. So what is the person's primary language? If it's not English, we would like you to specify. We also want to know the person's preferred means of communication. Now we know here that oftentimes people will use more than one type of communication style, and that's totally fine, but what we're really looking for here is what is the most used means of communication the person uses. And if you don't know the most used, perhaps what is the person's preferred means of communication. We want to know about the person's mobility. This again is a check 1, so whether they move around their environment without aids, if they use some aids but use a wheelchair independently, or if they're non-ambulatory, so they always need assistance to move around. Beginning with question BI 17, we have some questions around health. So whether the person has a primary care doctor or care practitioner. We have questions around regular exams or screenings here. For each of these, we're looking for regular routine exams. So when was the last physical, the last dental exam, or routine dental care? This again is not an issue that the person perhaps had to go to the ER to have their teeth looked at, but that they're going in for regular routine care. We ask about the person's last eye exam or vision screening. When was the last time they had a hearing test, and whether in the past 12 months they've had a flu vaccine. We ask about height and weight. This is information that gets recoded to determine overall BMI for the state, which is an important indicator of overall health. It's also information that we sometimes use to connect to things like medication use and physical activity. We ask whether the person uses any kind of nicotine or tobacco products. This does include e-cigarettes. And then we have some questions around preventative screenings. So for females, when was her last Pap test? For those of you who've done this survey before, you may notice that the not applicable is slightly adjusted this year. We're only collecting information for females who are 21 and over now. For women who are 40 and over, we want to know when was her last mammogram. And for individuals who are 50 to 74, we are going to find out whether they've received any screenings for colorectal cancer. For this, we do have a check-all that apply, and we do want you to take a look at each of the type of screening and schedule and determine whether the person had that screening within the allotted time that we have here. Question BI 29 asks about the frequency of seizures if the individual has a seizure disorder. And then we want to know some information about medication use. So whether the person is taking medication to treat mood disorders, anxiety, or psychotic disorders. We do have a little bit of information here about what we mean by these types of medications. I do also want to point out that this does not necessarily mean that the individual is taking a psychotropic drug. They may be taking other types of medication, but they are used to treat these disorders, and that is the information that we're looking for here. So if they are taking medication to treat a mood disorder, anxiety, or psychotic disorder, we want to know how many. So 1 to 2, 3 to 4, 5 to 10, 11 or more. Question 32 is somewhat similar, but we're looking at whether the person takes medication for behavioral challenges. Okay. Again, if the person is taking medications for behavioral challenges, we want to know how many they're taking. We also want to know whether the person has a behavior plan. Then we're going to go into some questions around residence. So BI 35 asks how long the person has lived at their current home. BI 36 is how you would characterize where the person lives. Okay, so let's take a minute to look at some of these response options here for the type of place where the person lives. So we start out with this kind of bucket of the person living in an intermediate care facility or other institutional setting. So if the person's living in ICF IID, we want to know whether it's for 4 to 6, 7 to 15, or 16 or more residents with disabilities. They may be living in a nursing facility or another specialized institutional facility. This is kind of a catch-all for those larger institutions, especially those that may not be considered an ICF-IID. It may also be a group residential setting or group living setting that does not fit into the buckets below. So for the group residential settings, we're looking at settings that include 2 to 3, 4 to 6, or 7 to 15 people with disabilities. Oftentimes, these are group homes. And really specifically for all of these group residential settings, what we're looking for is that the setting is owned, operated, and or controlled by a service provider agency. So one way we can think of this is that if the person changed their provider, their service provider agency, would they have to move? And so if they would have to move, we would then determine that the place where they're living is a group residential setting. If the person is living in their own home or apartment or living with relatives or family, then we have the bucket for living in foster care or host homes. So we have a slight difference between these codings 11 and 12. So foster care or host home for 2 or more people with a disability. That 12 response option, foster care or host home, is for people who are living by themselves individually with a family who furnishes the services. Sometimes this may be referred to as shared living. And then we have those other response options. So if the person is perhaps homeless or in a crisis bed placement, they may be also living in some other type of setting that really does not fall into any of the buckets that we have predetermined here. And so you would just please specify what type of setting that is. Okay, so a little bit more here about where the person lives. So BI 37 is whether the person's residence is owned and controlled by a service provider. Again, we have that description of what we mean by controlled, indicates or means that if the person changes their provider agency, if they have to move, then we would know that the person's provider agency owns or controls where they live. I should also note here that when we say controlled, that means that the service provider is connected to the property or leased by ownership. Question BI 38 is if the person lives in a group home, ICF, or other specialized institutional facility, whether it's publicly or privately operated. Question BI 39 is whether the person is named on the lease, deed, or other legally enforceable rental agreement. And we do have separated out those yes responses, so the person is named on the lease or deed, and separately that the person is named on another legally enforceable rental agreement. We want to know whether the person owns his or her home, and whether the person has ever lived longer than a year in an institutional setting. I want to say here that we are looking for 12 consecutive months, so not necessarily that the person has been placed into institutional settings for shorter spans of time that equal over a year over the person's lifetime, but that over the course of 12 consecutive months, the person has ever lived in an institutional type setting. And finally, around residence, we want to know about what amount of paid support the person receives at home. So 24-hour on-site, daily on-site, scheduled that's less than daily, as needed visitation and phone contact, or none of the above. So that takes us to the through about the first half, a little bit more of the background information section. Our next video module is going to take us through the end of the background information section. Thanks so much for listening.